Bloom syndrome. The history of Bloom syndrome goes all the way back to 1954, where it was first described by David Bloom. There were a series of patients with telangiectatic arrhythmia on the face and dwarfism. Bloom syndrome is a rare autosomal recessive disorder that has three main features, which include sun sensitivity, telangiectatic arrhythmia of the face, and stunted growth. Patients with this disease show a much higher chance of developing malignant neoplasms, which contributes as the major cause of death in these patients. No patients have been reported to reach over 50 years of age. This disease also causes the patients to have immunodeficiency, which exposes them to various infections because of their weak immune system. Bloom syndrome is caused by a genetic mutation in both alleles of the gene named BLM. BLM encodes 1,417 amino acids that code for a protein in the nuclear matrix of growing cells. BLM mutations result then in defects of DNA repair and genomic instability in somatic cells. Geneticists have a special interest with this disease because it bears chromosomes that are highly unstable, so mutations are frequently encountered. Over 60 mutations of the BLM gene have been found in the Bloom syndrome. The most common mutation is when 6 nucleotides are deleted at position 2281 and their replacement with 7 others, which occurs most commonly in Ashkenazi Jews. Bloom syndrome occurs within the first few months of life and has been reported in a variety of ethnic groups, but is more common in Eastern European Ashkenazi Jews, along with the male-to-female ratio being 1.3. Bloom syndrome mainly affects the musculoskeletal system and also the immune system. Patients present with stunted growth, low birth weight, and dwarfism occurs. There is also a way that Bloom syndrome affects the skin. When exposed to sun, a rash can occur which presents on the face in a butterfly formation along the cheeks and across the nose as macules or plaques. Male patients are infertile and female patients are subfertile. Patients also are more likely to develop respiratory and gastrointestinal infections. About 25% of patients with Bloom syndrome develop a malignancy of some type. About 10% develop diabetes as well. Bloom syndrome patients seem to have 150 to 300 times the risk of developing cancerous growths as do people without this disorder. There has been about 272 cases reported to the Bloom syndrome registry through 2012. The exact incidence is unknown. Neoplasms of all types and sites may develop from Bloom syndrome. Lymphomas, leukemia, oral esophageal squamous cell carcinoma, and adenocarcinoma of the sigmoid colon are the most common cancers reported with Bloom syndrome. Short stature, sun-sensitive skin changes on the face, hands and/or arms, a high-pitched voice, and distinctive facial features including a long, narrow face, small lower jaw, large nose, and prominent ears are all symptoms of Bloom syndrome. Some affected individuals may have learning disabilities, an increased risk of diabetes, COPD, and recurrent infections of the upper respiratory tract, ears, and lungs during infancy. Also, people with Bloom syndrome typically have abnormalities of the immune system that often result in inner ear infections and/or pneumonia. Other symptoms may include diarrhea and vomiting. More often than not, Bloom syndrome is diagnosed at birth. The genetic mutations in BLM changes the normal way that a chromosome replicates in the body. BLM gene mutations result in the absence of functional BLM protein. As a result, the frequency of sister chromatid exchange is about 10 times higher than average. There are a number of diagnostic tests that can be taken to determine if a patient has Bloom syndrome or not, but the main tests are genetic testing, prenatal testing, and diagnostic imaging. Immunoglobulin levels should be checked. Periodic leukemia testing as well as early screening for breast, cervical, and colorectal cancers are recommended. MRI and ultrasound are also recommended more than radiological tests because of the exposure of radiation to vulnerable patients. There is no cure for Bloom syndrome, and children with the disease should have nutritional monitoring in order to help them become as healthy as possible. People with this disease are advised to stay out of the sun and always wear sunscreen. Supportive and symptomatic treatment is also helpful. Early detection of cancer and appropriate treatment can help extend the lifespan of these individuals. Despite dealing with numerous medical problems, people with Bloom syndrome can lead productive lives. They are of normal or near normal intelligence. While men with Bloom syndrome are infertile, some women have been given birth to healthy children. Typically, people with Bloom syndrome lead shortened lives, but lifespan can vary greatly from person to person. The cause of death is usually cancer, which can occur in childhood but more commonly appears in the late teens or early to mid-20s. Thank you for watching my presentation. I hope you enjoyed it.